A lot of reasons why people will come into one of our clinics, right? And is they'll say, I'm low on energy. So when somebody says I'm low on energy, we just convert that to physiology. If you tell me you're low on energy, what you're really saying is I'm low on oxygen, right? And so if you're low on oxygen, one of the consequences, one of the causes of being low on oxygen is being low on red blood cells and being low on hemoglobin, right? Not anemic, but this hides in plain sight, right? Because a red blood cell carries oxygen inside of a fluid called hemoglobin. So when your red blood cell count is in the lower quartile, but it's still normal, and your hemoglobin is in the lower quartile, but it's still normal, this starts to compound, meaning it starts to reduce the oxidative state in the blood. You're carrying less oxygen. Well, if you go to the place in the body where red blood cells and hemoglobin are made, it's the bone marrow, right? So how do I get the bone marrow to produce more red blood cells, which would raise my energy level? You go to the boss of the bone marrow, which is the hormone testosterone. If you look at
in men and women, one of the primary roles of testosterone is
erythropoiesis, to put pressure on the bone marrow to create new red blood cells. This is why very often when men start hormone therapy, testosterone injections, they have to do regular blood donations, right? Because the bone marrow spits out so many red blood cells that the blood begins to thicken. It raises something called their hematocrit level. It raises their blood viscosity. So I would see in the medical record, man, this person is basically walking around anemic in plain sight. Their red blood cell count is right in the bottom quartile or bottom 10 percentile. Their hemoglobin level is super, super low. They're low on the hormone testosterone. They have no DHEA. They have no vitamin D3, and they're exhausted. And when they're exhausted, they also can't sleep. And as soon as the exhaustion would affect the sleep, then we would start to increase the rate of the debits. Because why is it that people that are the most exhausted sleep the worst? When you ask a doctor, why is it that the people that are the most exhausted sleep the worst? Because you would think it would be the opposite, right? You would think that people that are really exhausted, the one thing they would do really well is sleep. But the truth is, it's because they're both related to blood oxygen. Why are you tired? Because you're low on blood oxygen. Well, what happens when you lay down to go to bed at night? Your respiratory rate starts to fall. As your respiration rate starts to fall, the amount of oxygen coming into your blood starts to drop. Eventually, the amount of blood oxygen gets to a critical level as you're going into a delta wave of sleep. And as you start to go into that delta wave of sleep, your brain panics and it wakes you up. How does it wake you up? It pulses cortisol, right? So if you actually look at the aura ring of somebody that has low blood oxygen, you'll see that they look like a bouncing rubber ball going down the hallway at night.
Between what modes? Light sleep and deep sleep?
Between delta and alpha beta. And I'm not talking about...
I don't know how to read an aura ring in those ways.
Okay,
it just
so
says light,
between light
deep,
sleep
wake.
and deep sleep.
Okay.
So deep sleep, they'll bounce off the ground.
What should it look like? Should it look like you go light, deep, stay deep, light, wake?
Yes. Ideally, what you would look like is you fell off a cliff, and you laid at the bottom of the cliff for a while, and then you pop back out.
That is not what mine looks like. I worry that mine looks like the bouncing ball you're describing.
Your
not
mind
I worry.
Is
so
I
I bounce back and forth between light. So mine will go fall asleep fast. I'll go light for pretty brief, then deep, but then I'll pop back up to light, then deep.
Yep.
Then I'll go light, wake, then light, deep, light, and then wake.
Yeah, so
that's
it looks like
my
it's
typical,
blue and then it gets white and then it goes back down. It looks like broken teeth kind of.
Yes, I only hit white usually once to twice a night, but I bounce back and forth between light and deep.
So what's happening there? So yours isn't happening because you're exhausted, but when people are, this is why people that go on hormone therapy sometimes feel so good, right? Because what happens is when we normalize the level or optimize the level of testosterone, and if you actually want to look at the studies on this, you can go to the 2018 Journal of American Urology. So you see here that clinicians, so this is according to this is the Bible, by the way.
All right, let me just read this. Clinicians should inform testosterone deficient patients that low testosterone is a risk factor for cardiovascular disease.
Risk factor for cardiovascular disease, not the other way around.
Evidence.
There is strong evidence. So in other words, if I'm your doctor, and for the record, I'm not a doctor, I'm a human biologist, but if I'm your doctor and you're low on testosterone, what should I inform you will happen if you get on hormone therapy. Well, first I should.
I always thought I wanted to leave my testosterone alone as long as humanly possible.
You do. This is why.
Sort of. I want to get it up if it's low.
You want to get it up if it's low by giving your body the raw material to make it on its own. So you want to look at your DHEA level, your vitamin D3 level, and you want to look at a very specific protein in the blood.
How do I get DHEA?
Just pull DHEA on your blood.
No, how do I eat it? How do I consume it?
Well, the best way is to supplement with it, but you can get dihydroepiandrosterone from certain cruciferous vegetables, but
100,000 years ago, I wouldn't have been able to supplement. So what would I do? Chew on the bark of a tree, eat
cruciferous vegetables.
Interesting.
Yeah.
We're gonna have to go into carnivore versus vegan at some point here.
Yeah, I mean that's. I'm ready. Are you a vegan?
No.
Oh, okay.
No.
Because
But I
have a heck
no
of a debate
philosophical
on that.
thing. I just want what's effective.
Carnivore is very effective.
But you just said to eat cruciferous vegetables to avoid low testosterone.
Yeah, but you could also eat grass-fed meats. I mean, grass-fed meats, and I'll give you a whole. We can talk about grass-fed meats, eggs, raw dairy, pasture-raised chickens, pasture-raised eggs. Again, the problem is it's not the meat. It's the industrial processed meat. I mean, grass-fed meat is excellent for you. So are pasture-raised eggs. In fact, the only thing of any consequence when you're buying eggs is that they should be pasture-raised, not that they're cage-free, because that just means that chicken's out of the cage when they feed them a bunch of shit.
You want them eating worms and bugs.
You want them eating worms, bugs, in grass. I mean, just like when a cow eats grass, it doesn't just eat the grass. It actually gets soil. It actually gets minerals, zinc, magnesium, nutrients from the soil. But if you see here, patients should be informed that testosterone therapy may result in improvements in erectile function, low sex drive, anemia, bone mineral density, lean body mass, and/or depressive symptoms.